What's going on, guys? It's Nate Humphrey, and today we'll be talking about seasonal affective disorder, or SAD as short. It is a type of depression. It happens during certain seasons of the year, most often fall or winter, the darker of all the other ones. It is thought that shorter days and less daylight may trigger a chemical change in the brain, leading to symptoms of depression. Light therapy and antidepressants can help treat SAD. Who is at risk for SAD? Usually starts during childhood. The risk of SAD increases with age. It's rare in a person under 20. Women are affected more than men. Dude, I just want to give a shout out to all the girls out there, because you guys have to deal with a lot of shit. Like, you get like,
affective disorder.
Hey, shut your ass up, bro. Like, you guys have to give birth. You guys have to have periods. And shut your ass up, bro. Hey, shut your ass up. I'm doing a video. Yeah, okay. Yeah, you guys have to are on your period every month, maybe, and you guys have to give birth to little people. I give you guys props. You know what I'm saying? I love every single one of you guys. Hopefully you guys are doing good. And yeah, you guys are beautiful, dogs. Alright, I give you props, dog. I would be able to believe that shit. I love you guys. Okay. What causes SAD? Less sunlight and shorter days are thought to be linked to a chemical change in the brain and may be part of the cause of SAD, or seasonal affective disorder. Melatonin, a sleep-related hormone, also has been linked to SAD. The body naturally makes more melatonin when it's dark. So when the days are shorter and dark, more melatonin is made. What are the symptoms of SAD? There are two types of SAD. Fall onset. This is called winter depression. Symptoms of depression begins in the late fall to early winter months and ease during the summer months. The next one is spring onset. This is called summer depression. Symptoms of depression begin in late spring to early summer. This type is much less common. The following are the most common symptoms of SAD: increased sleep and daytime drowsiness, loss of interest and pleasure in activities formerly enjoyed, social withdrawals and increased sensitivity to rejection, irritability and anxiety, feeling of guilt and hopelessness, fatigue or low energy levels, decreased sex drive, decreased ability to focus or concentrate, trouble thinking clearly, increased appetite, especially for sweets and carbohydrates, weight gain, physical problems such as headaches. Symptoms tend to come back and then improve about the same time every year. The symptoms of SAD may look like other mental health conditions, also seeing a healthcare provider for a diagnosis. How is SAD diagnosed? Depression often happens with other conditions such as heart disease or cancer. It may also happen with other mood disorders such as substance abuse or anxiety. For these reasons, early diagnosis and treatment is key to recovery. A diagnosis of SAD may be made after a careful medical health exam, and medical history done by a psychiatrist or mental health professional. How is SAD treated? Exposure to sunlight, spending time outside or near a window can help relieve symptoms. Light therapy, if increased sunlight is not possible, exposure to a specific light for a specific amount of time each day may help. Psychotherapy, cognitive behaviors, or interpersonal therapy helps change the distorted view you may have on yourself and the environment around you. It can help you improve interpersonal relationships and skills. and identifying things that cause you stress as well as how to manage them. Antidepressants, they try to help the chemical balance or imbalance within you. So there's also things you can do for yourself to help relieve symptoms. Get help, like always. Set goals in light of the depression. Don't take on too much. Break large tasks into small ones. Set priorities and do what you can as you can. Try to be with others and confide in someone. It is usually better than being alone and secretive. Do things that make you feel better, like your hobbies, that stuff you like to do. Walk, gardening, part of like a religion, like a church. Whatever you like to do, just do that. Go for it. That will help your mood. Get regular exercise. Expect your mood to get slowly better, not right away. Feeling better takes time. Eat healthy, well-balanced meals. Stay away from alcohol and drugs. These can make it worse. Delay big decisions until the depression has lifted. Before deciding to make a significant transition, discuss it with others who know you well and have a more objective view of your situation. Remember, people rarely snap out of depression, but they can feel a little better day by day. Try to be patient and focus on the positive. This may help replace the negative things that is part of the depression. The negative thoughts will disappear in your depression response to treatment. And lastly, just let your parents and friends like help you out with like talking or just getting you in a better mood. Key points about SAD is the type of depression that happens during a certain time of the year, most often fall and winter. There's no clear cause of SAD. Less sunlight and shorter days are thought to be linked to a chemical change in the brain, maybe part of the cause of seasonal or SAD. Melatonin, a sleep-related hormone, also may be linked to SAD. In general, nearly everyone with depression has ongoing feelings of sadness and may feel helpless, hopeless, and irritable. SAD may be diagnosed after a careful exam or medical history by a psychiatrist. Depression is most often treated with light therapy, and is some cases antidepressants. So if you guys think you might have this, just try to keep your mind at ease and do stuff that you like to do. Like sometimes when it's like the winter time, I like to go sledding, like make little ramps and shit, like up in the snow. I like doing that. Like just find something you like to do and just shoot for it. You know what I'm saying? Like, you guys know what makes you happy and everything like that. So let me guys know what you guys like to do, like when it's like fall or winter. Or maybe you're like from Florida or like a place that doesn't get very cold. Let me know down below where you guys are from. You know, you guys don't have to tell me exact location. I'm from a little town called Whitewater, Wisconsin, or back in best known as Second Salem. I do have music about the history of Whitewater, where I am. I also am Wisconsin. I'm from Wisconsin, so as you guys may have known. So I love cheese. You know the big ass blocks like this. I know this is off topic and shit, but I can just take that block and just eat it. You know what I'm saying? You guys might think I'm weird as shit, but alright guys, I hope you guys enjoyed this video. If you did, make sure you give a thumbs up, hit that subscribe button, turn your post notifications so you don't miss out. Be sure to stay safe and warm. I love you guys. I will see you in the next video.